My name is Dr. Rudy Acosta. I've been doing no scalpel vasectomies in my office for the last 25 years. My main concern is that my patients have a stress-free procedure in the office. I want them to be as comfortable as possible during the consulting phase and during the procedure. After the procedure, if there's any concerns, I'm more than glad to see the patient post-operatively, but commonly there is no need for a post-op visit, and most people have very little problems with this procedure. I'm going to explain how the procedure is done, and please consult my website for any commonly asked questions. A no-scalpel vasectomy is started by anesthetizing the front part of the scrotum. A very small 25 gauge needle will be used. Once the area is very numb, the vas deferens is pushed to the front of the skin. Both the skin and the tubing, the vas deferens, are numbed. We allow adequate time for this to occur. A sharp hemostat is used to pierce the skin, spread the skin, and with a loose forceps, the vas deferens is pulled through the skin. Once the vas deferens has been localized, it'll be pulled through the skin, and the surgery is done at the skin level. A segment of the vas deferens will be removed. The ends will be cauterized or burned. Each end of the vas deferens will be tied off by a small inert piece of nylon. Some people use metal clips, which can be palpated in the future, but the small nylon stitches will not be able to be felt in the future. After the procedure, 20 to 30 ejaculations are required to get the remaining fluid with sperm out of the remaining vas deferens. After appropriate amount of time, we get a semen analysis. If there's no sperm in the ejaculate, we feel it's safe to resume unprotected sexual activity. The erection, the ejaculation will be the same. Most of the fluid in the ejaculation is from the seminal vesicles, and the amount of fluid will not change, and the sensation of the sexual activity will be no different. These are the instruments we use for a no-scalpel vasectomy. First of all, a 25 gauge needle, which is very small, is used to pierce the skin and anesthetize the skin and the vas deferens. I use more than an adequate amount of 1% lidocaine, 25 cc's, to anesthetize the patient. There will be minimal discomfort during the procedure. Once the vas deferens is localized in the skin, the sharp hemostat will be used to pierce the skin and spread the skin. No incision will be made with a scalpel, but the sharp hemostat spreads the skin. The looped portion of the forceps will use to localize the vas deferens. Once the vas is localized, a segment is removed, and this cautery is used to burn each end of the vas deferens. This small nylon, which is inert and does not dissolve, will tie each end off. We use sutures that do not dissolve because it decreases the likelihood that the tubes can ever reconnect. After the procedure, I normally just put a small piece of gauze on the opening. Usually it's not even necessary to put a stitch in the skin, and the patient will pull their tight underwear up and simply walk out of the office with a piece of gauze over the opening. The patient is able to usually drive home if they're comfortable with minor procedures. I want my patient to have a procedure, an experience that is comfortable for them and as stress-free as possible.